My name's Ed Slack. I'm from Guthrie, Kentucky. First met Dr. McCord in the mid-90s. I was in helping my neighbor work cows one day, and a cow kicked a gate, hit me in the shoulder, knocked me back, and hit a 6x6 post. And the next day, my arm went numb. I came to Nashville to see a Dr. Davis. It was an emergency type surgery, and he switched me over to Dr. McCord. And that was the first time that I had met him. The surgery that we did at that time, he took C6-7 out, put a cage in, took bone off my hip, put in that cage to cause it to fuse, and everything did fine. I saw him 2 or 3 times over the next 3 or 4 years. He released me, didn't see him again till 3 years ago. At that time, I was riding a 4-wheeler, and I could start feeling pain in my arm again. Within a few days, I had some numbness, came back, and at that time, he had the open MRI. I had not any idea what this was. I went to it. Instead of going in through a tunnel, you sit down in a position, and they take the pictures just like they would in an enclosed MRI. You hear the same noises, you hear everything, but you're sitting out, you can watch TV, you can listen to music. And the most interesting part of that MRI was the way they took pictures of my neck. After they did the general pictures, they positioned my neck in 9 positions. They would start out at the very back, take a picture, keep moving up, keep moving up, keep moving up, and then they start going down, which he could tell by looking at those pictures where the disc was kind of causing more pain on the nerve. I went into his office the next day, and he said, "Look at this." He flipped a switch just like that, and my neck was moving. And it was the most fascinating thing that an MRI could show that kind of stuff. That surgery was done. It wasn't an emergency like the first one. It was done within the next 2 or 3 weeks. I came out of it doing perfect. I was back shooting my shotgun, hunting, working on the farm, working at my job at the bank, and I have had no problems since then. I would recommend anybody to see Dr. McCord, not only from the good surgical standpoint, but using the open MRI. Yes, yeah, I had a cage in both disc area, two cages, and then once we had this third one, he took the 2 cages out and put a cage in on both sides. When Dr. McCord fixes you, it's fixed. The first surgery was 15 years ago. It's still holding fine. The second surgery I had was on a separate disc, C5-6, and it's still holding good.